So in this video we are going to talk about special test of the cervical spine. This video is continuation of my previous 3 videos. So in this video we are going to talk about shoulder abduction test or shoulder relief test. The second one is a shoulder depression test, and third one is a Tinel sign for the brachial plexus lesions. So we'll start with the shoulder abduction test, shoulder relief test. The other names are Bacody's test, Bacody's sign. In this, the patient is either sitting down or in a laying down position. Examiner passively or patient actively abducts the shoulder and put the arm and forearm on top of the head. While doing that, the signs and symptoms or the radicular pain is reduced, mainly because there is a compression at C4, C5 level and sometimes at C5, C6 level. All the compression are extradural in nature. So extradural means patient either has a herniated disc or nerve root compression or epidural vein compression. And pain, it can be referred either by the dermatome or myotomal pattern. Now, if you see the logic behind this test, the shoulder abduction or shoulder abduction test relieves the symptoms. So when a patient put the shoulder abduction and put the arm and forearm on top of the head, that means there is a decrease in the length of neurological tissue from C4, C5 to the upper extremity. This is increase in the neurological tissue, the distance from C4, C5, but patient tries to decrease the symptoms and decrease the length of the neurological tissue, and the signs and symptoms will release. But if the pain is increased while putting the hand on top of the head, that means there is a increase in pressure in the interscalene triangle. Now, interscalene triangle has a clinical significance because the roots of the brachial plexus and third part of the subclavian artery passes through the interscalene triangle. So increase in the pressure of the interscalene triangle indicates a thoracic outlet syndrome. Now, let me talk a little bit about the scalene triangle. So scalene muscle has 3 heads: scalene anterior, scalene medius and scalene posterior. It starts from the transverse process of the cervical vertebra and goes down or spanning between the first 2 ribs. The borders of the scalene triangle is the lateral border of the scalene anterior muscles, the medial border of the scalene medius muscle, and the inferior border is by the first rib. So that is all about the shoulder abduction or shoulder relief test. So patient tries to decrease the distance of a neurological tissue from C4, C5 to the upper extremity. If the distance is increased, that means ULTT, that I'm going to cover in my coming video. So upper limb tension test. Second is a shoulder depression test. So in shoulder depression test, examiner tries to evaluate the brachial plexus lesions. The test position itself is a mechanism of a brachial plexus injury. In this, if the brachial plexus is injured, that means patient has more than one nerve roots are involved. So how to check the test? Patient is in a sitting position. Examiner tries to side flex the patient's head, for example left side, and depress the shoulder on the other side. That means depression on the right shoulder. So if the pain is increased, that means the brachial plexus is stretched. Now, what is the differential diagnosis? So if the pain is increased on the same side or the side of compression, that means the nerve roots are compressed or the facet joint arthropathy or osteophytes in the facet joints. But if the pain is increased on the stretch side, that means either there can be a hypomobility of the joint capsule or a stretch in a dural sleeve. And of course, the pain will radiate into the dermatomal pattern if the pain radiates to the upper extremity. The last is the Tinel sign for the brachial plexus lesions. In that, patient is in a sitting position. Examiner tries to side flex a patient's head a little bit and taps on the brachial plexus. Taps on the nerve trunk, either with the finger or a knee hammer. If the pain is localized, that means the patient has a brachial plexus lesion positive. But if the Tinel sign is positive, means the radiating pain in the dermatomal or myotomal pattern, that means tingling sensation on a course of a nerve root, that means patient has a brachial plexus lesion but some recovery is occurring. Thank you. In my next video, we are going to talk more about ULTT. Remember the increase in a distance of a neurological tissue from neck to upper extremity. Thank you.